we do know that underrepresented minorities access neuromodulation at a lower rate than their white or majority counterparts. And actually, in a recent study conducted by Dr. Mark Jones and colleagues, this is the largest national review of disparities in the United States, looking at the Center for Medicare Services database. What they found in looking at over 1.2 million patients who had the diagnosis of post-laminectomy pain syndrome or chronic pain syndrome, both indicators for spinal cord stimulation. Of those 1.2 million patients, only 4.8% of patients actually accessed spinal cord stimulation or provided that as a treatment option. And of that 4.8% of patients, we found that Black, Hispanic, Asian, and North American Native patients were significantly less likely to access spinal cord stimulation than patients who were white. And that held true even when we're matched for clinical and socioeconomic factors. The goal of patient outreach for pain patients is really to inform patients that there are options to treat their pain other than necessarily pills or injections that have to be repeated monthly or every 3 to 4 months. Spinal cord stimulation is really a life-changing treatment option for many patients in that it can improve their function and quality of life in a way that many other treatments are just not able to do it. And so to inform patients that the treatment option is available to them is really one of the main goals of patient outreach. The types of outreach that we found works with pain patients is really just starting with a conversation, letting these patients know that we first of all hear them, we see them, we understand that pain is really limiting their ability to enjoy life and their ability to function the way that they'd like to. And so once we've made that connection with patients, whether it be face-to-face in the office, whether it be at their primary care practice, whether it be out in the community via social media or direct-to-patient channels, just making the connection and having patients feel heard is the first step in outreach. Once we've done that, then we can move to education, which is where we inform the patients of the treatment options that are available to them and how certain treatment options can really help them meet their goals of improving their quality of life and function. And then when it comes after that, we want to make sure that we are assessing and providing adequate access to the treatments, making sure that both their clinicians and the patients are aware of these treatments so that they're not left out of these opportunities. So providers play a very important role in outreach. When we have an opportunity to communicate with patients, our primary role is really to connect with them and also to educate patients. One of the reasons that we at the University of Tennessee have taken such a strong stance in educating not just pain specialists, but primary care physicians also, is that we want to introduce these therapies to patients as early in their patient care journey as possible. That's one reason that we have a conference annually called the Targeted Pain Treatment Conference, which is going to be held March 5th this year, and it's virtual. The goal of the conference, or the theme, is focus on function. So we will be speaking about all of the ways that function can improve overall health and wellness, and how targeted pain treatment specifically can help patients improve their function and overall quality of life. Again, I think it really starts with making sure that rather than treating the outward appearance of the patient, that we really focus on ensuring that we have an accurate diagnosis. The evidence stands, no matter what the patient's race or ethnicity is, that different diagnoses or causes of pain have evidence-based treatments. And so if we focus on making sure that we have accurately identified the diagnosis as clearly and closely as possible, and then that we are equally and across the board applying evidence-based treatments to those diagnoses, we'd be able to, in one way, we'd be able to ensure that we're not allowing race and ethnicity to cloud our treatment options for these patients. It is actually, it sounds a little bit easier than it is to just say focus on the diagnosis, but that really is one of the cruxes or the foundations of it. Outreach is really a combination of three things: awareness, advocacy, and application. And by applying those three things, awareness, advocacy, and application, to ensure that socioeconomic disparities or racial disparities do not factor into evidence-based treatment options for patients, we can increase awareness and access to our patients for these life-saving and life-changing neuromodulation therapies.